Our next speaker, my friend, Dr. Bill Meyer, the chair of the Jimmy Evers section of Pediatric Hematology Oncology and the Children's Hospital Foundation Ben Johnson Endowed Chair. Bill?
Thank you, Joe. The journey to cure childhood cancer began in Boston with Sidney Farber's testing of antifoals, probably the first targeted drugs designed to deplete leukemia cells of folates soon after World War II. In September 1947, almost 70 years ago, a 2-year-old boy with leukemia was the first child to receive one of these new antifoals provided by Dr. Farber. Subsequently, he picked methotrexate as the best of these folate antagonists, and methotrexate is still an agent we use every day as part of curative therapy for every child with acute lymphoblastic leukemia. But despite hints of activity from these exciting new drugs, all of these children died. Not satisfied with these preliminary results, in the early 1950s, Farber began studying other classes of agents, including one called actinomycin D. Farber likely was disappointed that this drug had no effect on leukemia, but it dramatically shrank several types of childhood solid tumors, including a cancer called Wilms tumor. We treated Representative Nelson's daughter, Grace, with actinomycin D. This old drug is still part of our frontline therapy for this most common of childhood cancers of the kidney. Today, from basic science discoveries, translational research efforts, many cooperative group clinical research trials, and the commitment of countless families, the cure rate for childhood acute lymphoblastic leukemia approaches 90%, and the cure rates for many other childhood cancers have also dramatically improved. Today, we cure about 84% of all children with cancer. We've made great strides and cured many children and adolescents with cancer. But as many of us in this room know all too well, too many children still do not survive, and many suffer substantial late effects of curative therapy. The only path forward is continuing and expanding our research efforts, and it is important that this TSET initiative is dedicated to pediatric cancer. For cancer in children are not exactly always the same diseases that occur in most adults. Often they're distinctly different, and our approach to care is often also distinct. Although we don't know what causes most cancers in children, environmental factors rarely are involved, unlike the impact for tobacco in adults. Many common childhood cancers are caused by specific gene fusions and etiologies seen pretty infrequently in adult cancers. We've cured many children with relatively non-specific cytotoxic therapy, killing the cancer cells but harming many other normal cells along the way. But few efforts are now focused on discovering new cytotoxic agents. Very appropriately, adult cancer care is relying more and more on precision medicine, with new agents aimed at specific targets on and in cancer cells. But few pediatric cancers share such targets with these adult cancers. The FDA approved 9 new agents for adult cancers in 2014, 20 in 2015, and 14 already this year. But only 3 new drugs have been specifically approved to treat children with cancer in the last 20 years. Much work needs to be done, but much of it won't be done by industry. Childhood cancer is too rare with few incentives for the pharmaceutical industry to develop drugs specifically for children with cancer. This is why partnerships like the one we celebrate today are so very important. Today's announcement is a landmark commitment to Oklahoma's children with cancer and their family, as you've heard, leveraging TSET dollars with support from OUHSC, the Stevenson Cancer Center, the Children's Hospital Foundation Pediatric Cancer Endowed Chair Program. This partnership will enable us to recruit new scientists committed to further unraveling the mysteries of childhood cancer. Dollars will be committed to translating new basic science discoveries to the bedside And as you've heard, support for expanding our children's oncology group efforts will provide access to these cutting-edge clinical studies for all of Oklahoma's children with cancer. We expect this initiative will enhance the Stevenson Cancer Center's efforts to obtain NCI Comprehensive Cancer Center status. This designation then to pediatric cancer. Ultimately, the winners are the children and adolescents afflicted with cancer who will benefit from these investigations and through access to cutting-edge clinical research studies without leaving the state. For many of us, this is deeply personal. Didn't think I was going to do this. We are forever grateful to the Evers family who built our outstanding outpatient facility and have continued to support our program in so many ways after their son Jimmy died of Ewing sarcoma. The Llewellyn family created the CHF Trip Llewellyn Endowed Chair after his battle with leukemia. Representative Nelson has spearheaded the TSET initiative after his daughter Grace was diagnosed with Wilms tumor. And my family lost her 21-month-old grandson, Bo, last July from neuroblastoma. Sorry. You will next hear from Brock and his family about their personal journey. We must do better, we can do better through this exciting new partnership. I sincerely thank the TSET board, Dr. Sanders, Dr. Mantle, Representative Nelson, the Everests and their family, the Llewellyns, the Bobby Mercer family, Children's Hospital Foundation, and our families for the opportunity to better serve our children with cancer in Oklahoma. Thank you. Brock, it's your turn.